And so you'll be able to see here, if we do a little test site, this is the pattern that's laid down. And we have our smoke evacuator because this is ablative, so you'll see some smoke, little columns that are left behind. So we're going to go 1, 2, 3. You can basically, or should be able to see on the tongue blade what that looks like. Now that she's been treated with the pulse dye laser, and as I mentioned before, for the amount of time that we took as a pause from the completion of that until we start our fractional CO2 laser treatment, you can see more of a response here, more of this sort of black and blue or purpuric response, which is essentially shows that this is still in a little bit of evolution. You actually feel it, it's a little bit warm, and so that's the heat sink effect of what's happened. And so basically this is a very reasonable response, and something that I think is, for her, the settings that we chose, entirely safe, and that she should do quite well with. I'm going to do the test site very close to where I did her previous test site. 1, 2, 3. And I think you should be able to see the pattern that's been laid down, very similar to what we had with the tongue blade. And you can also see a few areas here of bleeding. And so why that's important is because of the fact that this is going down a certain depth based on the energy I've dialed in into the scar. And those little vessels that were targeted initially by the pulse dye laser, you saw that there was really no bleeding. What you did see was the after effects of that under the surface of the skin. But because this is an ablative laser, what's happening here is that not only did we have ablation of the scar, but any blood vessels that are in that vicinity or within the depth of that area also were affected. 1, 2, 3. And we'll basically go on in this pathway throughout until we treat everything thoroughly. So now we've basically treated her whole face with both of the lasers that we are going to use today, the pulse dye to start off with, and then the fractional ablative CO2. She's had a very nice response. Typically what we do now is over this we're going to put some topical steroid, also known as Kenalog. This is basically what's essentially known as laser-assisted drug delivery. So we can make little targeted injuries to the scar, but we can also use this to deliver other drugs, topical vitamins, other things that are under active investigation now, which we ourselves are looking at and trying to figure out what's best to treat these areas with as an adjunct, because now that we've essentially started this wound healing response, we really want a fertile ground here for this area to remodel and do everything it needs to do to the best of its capacity, and part of that is providing the right substrate to the wound. The bleeding that you see here and some of that fluid associated with it also has factors in it, and is actually believed to have an effect as well. And so we just sort of let that stay on there until we do the dressing change, which she's going to leave the operating room with. And now what we're going to do is, now that we've treated her face, we're going to work our way down the torso. As you can see on the torso here, she's had areas of scarring that we've treated here with traditional surgery. She's also been treated elsewhere, obviously, when she had her initial injury. She was skin grafted, and you can see evidence of that.